Okay, let me convene us. Good afternoon, good evening, good morning of people in the room, people on Zoom. Welcome, it's great to have you here. My name is Sandro Galea. I have the great privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome to today's Public Health Conversation. This is part of a series of public health conversations that we host that are spaces where we come together to discuss the ideas that shape a healthier world. Our goal is to encourage discussion and the generative exchange of ideas that sharpen our work. We're guided by expert speakers and work to a deeper understanding of what matters most to the creation of healthy populations. Thank you for joining today's conversation. I feel like I'm echoing. Is that just me? Yeah, it's not just me. I'll just keep talking, hoping the echo fixes itself. In particular, a thank you to the Dean's Office and our communications team, without whose efforts these events would not take place. For this particular event, I would like to acknowledge Professor Scarlett Bellamy, Laurie Chibnick, Anita DeStefano, Jackie Hicks, Helen Jenkins, Mary Murphy-Phillips, and Dean Lisa Sullivan for their contributions in shaping today's event, and to the BUSPH SIBS program, the Summer Institute in Biostatistics and Data Science programs. Today, we're going to talk about the future of biostatistics over the next decade. We're going to talk about how we can develop the field and shape a more diverse pipeline for biostatistics as it evolves. Our conversation will be guided by reflections from alumni of the SIBS program at the school, which is now known as the Summer Institute in Biostatistics and Data Science. The program is a federally funded effort to grow and diversify biostatistics, and excitingly, this year marks the 20th anniversary of the SIBS program at the school. I am delighted to celebrate this milestone with all of you, and I look forward to learning from our guests today. It's my great pleasure now to turn the conversation over to our first panel moderator, Dean Lisa Sullivan, our Associate Dean for Education. Dean Sullivan.
Thank you, Dean Galea, for the introduction. It is my great pleasure to moderate our first panel. In 2004, Boston University School of Public Health was funded by NHLBI as one of the first 3 SIBS programs, along with NC State and Wisconsin. The goal was to introduce undergraduates to the field of biostatistics, and I'm proud to say that we've maintained NIH funding 20 years later. Over the 20 years, we've had many very passionate faculty and staff working on this program. I was the original PI, and then I asked Anita DeStefano to work with me as co-PI. It was actually Anita's idea for this 20th anniversary event, so we can thank her for her continued commitment to SIBS and for bringing us all together. Unfortunately, Anita couldn't join us today in person, but she's with us on Zoom. I then stepped away, and Anita engaged Jackie Hicks as co-PI. And then Anita stepped away, and Jackie engaged Helen Jenkins. I loved working on SIBS, and I know the same was true for so many faculty, staff, and guest speakers who make it such a special program. I'd also like to thank Professor Scarlett Bellamy, our current chair for biostatistics, for her support of SIBS in this conversation. One constant throughout the 20 years has been the quality of the SIBS students. The first year, and every year since, we've all been amazed by the dedication, curiosity, thoughtfulness, and abilities of the students who chose to spend 6 weeks of their summer break learning biostatistics. Over these 20 years, we've seen changes in the students and in the SIBS programs. We started with 3, and now there are 10, which reflect changes in the field of biostatistics over those 2 decades. Today, more students know what biostatistics is. In the early years of SIBS, most students said they'd never heard of biostatistics, didn't really understand what it was. Very few undergraduate programs had courses in biostatistics. Now many students know about biostatistics and have taken a course or 2, but many still lack exposure to the breadth of areas within the field and the many distinct career paths available to them. More students now come to SIBS with some programming experience. It was always our goal to teach both SAS and R. In 2004, statistical programming was new to almost all SIBS students. Now more than half are likely to have some statistical computing experience. This reflects changes in the field, including increased computing power, the availability of R, and the many YouTube tutorials that are available. Over the past 2 decades, the SIBS program shifted focus from building a pipeline of future biostatisticians to expanding the diversity of future biostatisticians. In our SIBS program, we featured the Framingham Heart Study, as many of the SIBS faculty were engaged in the study. Students got the opportunity to work on real data and even to visit the Framingham Heart Study Clinic. We talked extensively about the many achievements of the Framingham study and the fact that the cohort was predominantly white and that results may not generalize to non-white populations. Thus, in 2012, we partnered with the Jackson Heart Study, the largest longitudinal study of cardiovascular health in African Americans. Our faculty became more thoughtful in our selection of data sets, speakers, and topics to ensure broader representation as a way to better engage a diverse group of students and to best equip all students to practice biostatistics in a diverse world. In 2019, we incorporated an infectious disease module into BUSPH. We then pivoted with the rest of the world to a virtual program during the pandemic. During those pandemic years, the grant was up for renewal, and NIH put out a request for proposals with an emphasis on infectious disease training and data science. We were well positioned to respond. The current SIBS program is called the Summer Institute for Biostatistics and Data Science, and it is funded by NHLBI and NIAID. I think I speak for the many faculty, staff, and guest speakers involved in the program that we have been consistently funded and successful for 20 years because of our ability to embrace the changes in the field and to innovate to attract and prepare future biostatisticians. I look forward to hearing from our panelists today and their views on how biostatistics will evolve over the next decade and how we can together support building a diverse pipeline of biostatisticians in the coming years. I'd now like to introduce our first speaker for this program, Brittany E. Bailey. Dr. Bailey is an assistant professor of statistics at Amherst College. Her research explores statistical methods for dealing with missing data in clustered clinical trials, and her collaborations have focused on social and behavioral interventions to improve mental health and well-being. As a Black woman in STEM and a first-generation scholar from a low-income background, Dr. Bailey is dedicated to supporting students with similar experiences and works to create environments where all students can thrive. Within Amherst College, she co-founded the STEM Incubator Program, and on the national level, Dr. Bailey is the current vice chair of the American Statistical Association's Committee on Minorities in Statistics, and is in her fourth year as co-chair of the planning committee for the Committee on Minorities StatFest, an annual conference designed to encourage undergraduate students from historically underrepresented backgrounds to pursue careers in the statistical sciences. Dr. Bailey, we welcome you.
Thank you. Good afternoon. Oh, good afternoon. Oh, come on. This is like working with our students this summer, yesterday morning. I'm thrilled to be here today. I was a little overwhelmed with the initial question, what does the next 10 years of biostatistics look like? And I just think about how broad-sided I've been over the last 4.5 years with things I just did not expect to happen. I imagine many of you in the same boat, right? The COVID-19 pandemic, this sort of rising inflation that we're all dealing with that's making it hard to afford the basics, housing affordability crisis, which I feel a bit acutely here in Massachusetts. These things I feel like I did not foresee 5 years ago. And so it's hard to think about what the next 10 years of biostatistics looks like, knowing that these types of issues are issues that especially affect marginalized communities and fall hardest on low-income families especially. And that in turn affects the types of problems we might address as biostatisticians with our collaborators. It might affect how we go about trying to address those problems, including thinking about AI and what impact that might have on the field. But it especially is going to affect who is going to be able to be in the room thinking about those problems and working on those problems with us, which is why we're here today, to talk about what does it look like to build and grow that pipeline. And reflecting back on 20 years ago for me, I think I was that picture in the middle at that time. And so as you shared, I was the first in my family to go to college, and before that, I was a student at a small rural high school. So there were fewer than 1,000 students, 1,000 people in the town at the time. I'm sure that's still true today. And I was one of a handful of students of color in the entire K through 12 building that we were in. It wasn't the best high school by any means. We didn't have any advanced classes. We didn't have any AP classes. And I put up there the one line, the one exposure to statistics I had at the time, which was a trig and stats class. So it was half of a semester course, and it was actually taught by a sub. One math teacher had retired, another had left the previous year, and we were waiting to hire somebody new. So I didn't really have much of an exposure to statistics in high school. So somehow, though, I managed to be here today in front of you as an assistant professor of statistics. And that's due to the connections I was able to make while I was in undergrad, while I was in grad school, and the types of programs I was able to be involved in that helped support me along the way, similar to the SIBS program that we're here to celebrate. So thinking about where we stand as a field, I pulled 11 years worth of data, degree data, graduate degree data, in statistics and biostatistics. And what we see is that Indigenous, Black, and Hispanic or Latino students make up fewer than 9% of degrees awarded in our field, which is a little disheartening given that even within the United States, they make up at least 25% of the population. So we could be doing better in terms of bringing students of color especially into our field. But the other part I think about with this is the intersection there tends to be between race, ethnicity, and socioeconomic status. So we see among those same groups, they are much more likely to be from families from low-income backgrounds in poverty. And we also know that lower family income is associated with higher likelihood of never enrolling, delaying enrollment, or never even completing post-secondary education. So part of our pipeline problem begins as children effectively in this country. And so what does it look like to try to think about getting students into undergrad in the first place and then into our field and supporting them so they can be successful all along the way? So my belief is that there's sort of 4 core things that we need to have in place in order to increase or bring people into our field and increase a sense of belonging. So the first is early exposure in the first place. Let people know what is statistics, what is biostatistics, what types of things do we do? Because you can't have people in the field if they don't even know what it is in the first place. Second is thinking about access to opportunities. And this isn't just thinking about access to academic institutions, it's also thinking about access to jobs, positions, promotions as they move along in their career. And then there's the people things, right? So thinking about who do they have in their network to support them, to give them guidance, to help them make those connections so they have access to opportunities and advocate for them along the way. And finally, the thing that I think is a little harder to work on is thinking about psychological safety. And so what I mean by this is that feeling of feeling valued in your program, in your workplace, in your field, feeling like your contributions matter, feeling like you can bring your whole self to the workplace. So these are the things I think we need in terms of trying to figure out how do we go about getting there. I've thought about a few things, and I've borrowed a few things from Jamar Bather and Melody Goodman have had some recent work. So these are in no particular order, but just going through some of these. First, I'm thinking about adopting equitable practices. And this is both within the classroom, within the workplace, within your academic institutions. Thinking about, as you are teaching, if you're an academic, what pedagogies do you use to try to support the broadest base of our students? Universal design is a common approach there. What admissions policies and hiring and promotion practices are we using to ensure that we have equitable access to opportunities? What are the cultural norms of our departments, of our workplaces, to help foster a sense of belonging? I think a lot about reducing barriers to entries, especially when it comes to financial barriers. But one thing is, again, just raising awareness of opportunities in the first place, providing financial support, maybe in grad school admissions process, those are fee waivers, in programs like SIBS or other summer research programs, thinking about making sure you're providing stipends, housing, whatever you can do to support students in terms of having access to the program in the first place. And then also fostering connections in the field. So maybe that's through mentoring or also through making connections in these research programs themselves. Third is developing and supporting existing programs. What can we do to continue the next 20 years of SIBS, right? And with that as well, beyond these summer research programs, there's also bridge-type programs, both entering undergrad, perhaps going from undergrad to graduate programs. What are ways that we make sure people have the foundations they need to be successful as they move forward in their academic career? And I actually had the opportunity to do this sort of last thing in that second bullet point, which was a postdoc to tenure track position, which let me sort of get my feet wet at Amherst College before then starting the tenure clock 2 years later. And finally, these ideas are less mine, and I give more credit to Melody and Jamar, thinking about creating learning collaborations. So a couple of examples they gave there were connections between larger, more well-resourced institutions and smaller institutions that maybe don't have as many resources. The University of Michigan School of Public Health partnered with Spelman College to create an accelerated master's in biostatistics, environmental health sciences, or nutritional sciences. And similarly, NYU and John Jay College of Criminal Justice in the city partnered to have some quantitative training and some seminars available to students. Or we can think about even having study away models so students can have access to maybe more resourced institutions. And then an idea actually that Tian Zhang shared with me, she's at Columbia University, was thinking about even academic and industry partnerships, especially with the rise of AI. What does it look like for an institution that doesn't have all the access that they can to computing needs for artificial intelligence? What does it look like maybe to partner with industry to have those resources on hand for students? So these are not all encompassing, and I'm sure the other speakers on the panel today have additional ideas, but this I think is just a start in thinking about, again, what does it look like to try to grow our field, develop a sense of belonging? Thank you.
Thank you, Dr. Bailey. Next, we'll hear from Mark Fayekas. Dr. Fayekas is an associate professor in the Division of Biostatistics and Health Data Science at the University of Minnesota. He also serves as chair of the Biostatistics Diversity, Equity, and Inclusion Committee at the University of Minnesota School of Public Health. The focus of his research is to understand the structure and function of the human brain through the use of imaging technology. His experience with neuroimaging research spans a broad range of areas, from studying the connectivity of the human brain to investigating genetic underpinnings of brain phenotypes. His interdisciplinary research focuses on functional connectivity and imaging genetics from a methodological perspective. His primary interest is time series analysis. Dr. Fayekas.
Thank you all for having me here today. I'd especially like to thank the Dean's Office here at Boston University for this invitation. This is a topic that I have a lot of strong opinions about, so hopefully that this is, I don't just blurt some of these things out loud, and I'll do my best to try to restrain myself on some of these topics. A lot of what I will talk about is Minnesota-centric, and when we think about biostatistics in the next decade, I think it's important to see where are we at right now. And in particular, I'd like to show you where we are, and we here being Minnesota. So let's first look at the male-female breakdown of our graduate program at the University of Minnesota Biostatistics and Health Data Sciences. So if we were to look at this, you'll probably see that regardless of graduate program, MS or PhD, roughly equal proportions between males and females. So from that perspective, it looks like that we're doing quite well. So this is, by the way, I will point out that this is for all of our students right now who entered as early as fall 2019. and only looking at domestic students. We do have an international student population, and I will show you a little bit of that shortly. So we look good here. There's nothing that seems like there's any type of disparities. Now, when we start to look at things with respect to race, this is where things get a little bit iffy. I'm not normalizing here or standardizing with respect to proportion, but you can just look at that last row and then see that that looks overwhelmingly large relative to the rest of the rows, and regardless of program, right? So I will also say that this is one of my strong opinions. I really hate that second row that says Asian. The reason why is that it is so collapsing. As a Filipino man, I actually find that a little offensive. I'm gonna restrain now. So if you were to look at this, this can be a little bit concerning, especially in the context of the University of Minnesota being a land-grant institution. As a land-grant institution, we should also be serving our local community. And this is not reflective of the population of Minnesota. And especially if we look at Black African Americans, 0 for PhD students. That's a problem. And I'm not offering a solution. I'm offering a start of a discussion. And I think that we can't talk about what the solutions are if we don't acknowledge that there are some potential problems here. And so that's what I would really like to highlight here. This is for the racial breakdowns for our domestic students. Now, if we look at international students, I mean, there's really only one row to focus here, which is the second one. Nearly all of our graduate students are, at least all of our international graduate students are coming from China, and then we have a couple from other countries. And so this hopefully gives you an idea of what University of Minnesota graduate student population is like. I can't speak, of course, to the other graduate programs around the country. I can't speak about BU, but this is where we stand. And so when it comes to gender breakdown, or at least male-female breakdown, sure, it looks good, but when we look at racial breakdown, it starts to see a little bit of a problem. What I don't have data on is socioeconomic breakdown. And I think that that's also important, especially when we start thinking about who is even enrolling into our program. So this is what our students look like. So we do try to set some things up on recruiting students into our programs. So we have, so I'm highlighting 3 things here. The first one is this program called Math Alliance. This is a nationwide program, and the idea here is to provide mentorship to undergraduate students from traditionally underrepresented backgrounds in the mathematical sciences to really encourage them to go pursue careers in the mathematical sciences, and also strongly encourage them to go to graduate school. So the University of Minnesota is a partner of this program. I will say that we haven't had a lot of success getting students from Math Alliance into statistics and biostatistics. One of the challenges here, again, disclaimer, this is one of my strong opinions, is that I feel like amongst the mathematical community, the feeling I get is that we are viewed as second-rate applied mathematicians. That is my impression. So if there are any mathematicians here whom I've offended, I do apologize for that. But that is the impression that I get being from Math Alliance. And so we haven't had a lot of success, but we are still a part of it because it is a way for us to really meet potential graduate students to talk to them about statistics and biostatistics. We did have a SIBS program. I cannot say that we are celebrating our 20th anniversary like BU. That ended in 2018 for us. And since then, we have been trying to get another summer program of sorts. And then this is where this last bullet point here, the REU. This is an NSF-funded program. We actually just started last week. So I am the PI of that program. It is very similar to SIBS, similar in spirit. 10 students, 10 weeks. So it's a little bit longer, but it is also half the size of a typical SIBS program. And a lot of what we focus there is on the what's called the Adolescent Brain Cognitive Development Study, which is the largest NIH-funded study on adolescent development. So the students are looking into projects analyzing that data with a keen eye towards disparities. And what I mean by disparities is broadly defined, whether it's racial, ethnic, or socioeconomic. I'm leaving that up to them. But this is what the where we are on what we are trying to do with respect to getting students exposed to biostatistics. I will also say that more broadly, the School of Public Health at the University of Minnesota is very much aware of how important it is to get people from other backgrounds into as a student of public health. Around late 2019, we began working on the strategic plan for anti-racism, and the need for this became very timely in Minnesota when I'm sure you know what happened in Minnesota, Minneapolis specifically, in May 2020. This is a massive document that we are very proud of. I certainly encourage you all to take a look. There's, I think, roughly 75 pages on what we plan to do as a School of Public Health to set ourselves up to be an anti-racist institution. I'm highlighting here one of the goals, one out of many, which is about the recruitment of students. Pretty much this topic, the reason why we are all here today. And some of the actions listed there is exactly what we're talking about, building pipelines and pathways to go from, am I someone who could be a part of this? Am I someone who sees statistics, biostatistics as a career, as a profession? That is one out of many things that we are hoping to do. With respect to that pathway, one of my beliefs, and I'll talk a little bit about this some more in the next slide, is exposing kids earlier to what is biostatistics. And we have a committee in our division that is committed to exposing high school students to what is the data sciences. On that note, I'll just like to end with these three hypothetical questions. When it comes to building a diverse pipeline, to me, this first bullet point here is, well, where are the gaps right now? And I showed you where our gaps where the gaps are at for Minnesota. But just broadly speaking, as a field, where are our gaps? I will tell you for Minnesota specifically, we have problems recruiting from people from the South and also California. The feedback I get a lot is Minnesota winters, but that's a different conversation. The second bullet point is something that I also strongly feel, I have strong opinions about as well. I mentioned earlier that I'm Filipino. I mean, I can challenge you right now. Can you think of 5 Filipino statisticians? Just 5, one hand. And if you can, that's great. Before I took my position at Minnesota, I was at the University of Warwick. And the question I asked my PhD supervisor, who is also Filipino, how many Filipino statisticians are there in the United Kingdom? And to our knowledge, the answer was 0. I was the first. And that has a very big psychological toll. And that can also be important when tragedy strikes. And that actually is what happened when a major typhoon hit the Philippines and I had no one to talk to. And the third bullet point is what I was talking about earlier about early exposure. A lot of this was motivated when I was attending the Minnesota State Fair and I see all these kids playing around with robots. Why can't they play around with data? And is there a way that we can make this cool and fun? And maybe not even about statistics, but just data literacy, because that is, in my opinion, where we start. Being literate in the data sciences means, being able to take, what looks like a spreadsheet and play around with that. And is that something that we can then do? And so I will end there, so thank you.
Thank you, Dr. Fayekas. We welcome your strong opinions. That's why you're here. And you're among friends, so it's all good. We'll next turn things over to Jackie Hicks. Dr. Hicks is a clinical associate professor of biostatistics at the Boston University School of Public Health and a lecturer in the Department of Computer Science at Metropolitan College. She is co-director of the Epidemiology and Biostatistics Certificate in the School of Public Health and the co-principal investigator of BUSPH's Summer Institute for Research and Education in Biostatistics program. Dr. Hicks runs the Public Health and Biostatistics Lab series for the Upward Bound Math and Science Summer Program, a program whose purpose is to prepare low-income and first-generation college-bound students for success. She runs a program within the Department of Biostatistics to better prepare graduate students for teaching in the field of public health. She also does research on new pedagogical methods in teaching introductory biostatistics courses to graduate students. Jackie.
Thank you, and it's so great today to have like a little mini reunion of SIBS, and I just want to thank Lori, Anita, and Lisa for starting the program, and I also want to thank Howard Cabral, who's been there since the beginning as well, and it's so great to see some of the instructor for SIBS here today and some of the alumni. It's nice to have you guys here today. So thinking about where biostatistics is headed over the next decade, we're in a really exciting time for the field, and there's a huge need for more biostatisticians. We have a big data coming up with more data in electronic health records. Many of you are wearing Apple Watches where we have mobile devices, so more data is being generated by the minute than ever, and there's a huge need for biostatisticians in data science than there has been ever. And with that comes for more challenges, but more opportunities for our field. So with that, we have more opportunities for personalized medicine, where we're just not applying medicine as a blanket for everybody, but we're tailoring medicine to the unique needs of each individual. We have more opportunities to develop methodology using machine learning and AI, developing clinical trials and drug development where we are tailoring techniques for certain groups of individuals, infectious disease modeling, and environmental health. But with that comes different problems. So as we saw with the COVID-19 epidemic, we have more people looking at what we call health equity. What we saw with COVID-19 is that these infectious disease and these public health problems and problems that we're seeing in medicine are affecting different groups of people more than others. And what we're seeing is that people who, different race and ethnicities, certain genders, are being affected more than others. And what we would like to do is to recruit biostatisticians, recruit a more diverse group of biostatisticians to help us tackle those health inequity problems that we're seeing. However, with these challenges, and some of my previous speakers have highlighted this, is that the biostatisticians that we're seeing in the field don't represent what we're seeing throughout the country in terms of our racial and ethnic background. What we're seeing is that biostatisticians in the field are more likely to be white, and again, Asian is kind of more of a blanket term, as was pointed out by my colleague. And what we're seeing is that people who are more likely to be affected by these health disparities are more likely to be Black and African American, Hispanic, and Native American, and they're less likely to go into the STEM field, less likely to be biostatisticians. And we need to recruit more individuals in these racial and ethnic backgrounds who are going to be more likely to be affected by these health disparities. So the question is, how do we recruit more of these individuals into these fields who are more likely to be affected by these health disparities? Now, biostatistics has always had a problem of diversity, And what we have done to help these problems is we've tried to introduce diversity into the a diverse student body into grad schools by trying to recruit more undergrads into the biostatistics field. And so we've done this by going to conferences like SACNES and Abercams to try to recruit more students into our field. And we've been very successful. And we've had programs like the Summer Institute in Biostatistics, where we've recruited undergrads and introduced them to the fields of biostatistics and data science. And SIBS has been a very successful program. We at Boston University have seen that anywhere from 90 to 95% of our students have gone on to graduate school. No pressure for our 24 SIBS students who are here. But I would like to argue that in order to increase diversity into our field, we need to look beyond just undergraduates. We need to go further down the pipeline. And I would say that we need to start looking at recruiting at the high school level, and even going further down to middle school and elementary school. So one of the things that I have done is I've started pairing with the Upward Bound Math and Science program. This is a federally funded program that helps prepare low-income and first-generation college students for success in undergrad. So this program does not only exist at BU, but there are several programs throughout the country. And this is a 6-week summer residential program where students get involved in different STEM careers. And one of the ones that we run here is the Public Health Series. So we have students involved in biostatistics, epidemiology, environmental health, global health, and we introduce students to the field of public health where they collect their own data. So we've gotten them involved in environmental health where they collect information on noise pollution and air pollution, and then we have them take that data, bring it into Excel, and then they learn R. They learn how to analyze that data. They learn how to develop their own research questions, and they learn things like descriptive statistics. They learn things like t-test and chi-square test. This can be done at the high school level, and I would venture that we can even go further than that, and we could start outreach programs at the middle school and elementary school level. And I've started reaching out at the middle school level, and you can teach them things like descriptive statistics. I've gone on and brought things like M&Ms and Skittles into the classroom and taught them how to generate descriptive statistics like frequencies, percentages. We do means, and we do things like standard deviations. Now, how the teachers feel after I leave and they're all sugared up from these candy, I don't know, but I say that it can be done, and I think we can even move beyond middle school and start thinking about going into elementary schools, because I'm telling you that students start to get disinterested in math and statistics much earlier on. Even I think it occurs early as elementary school. And so if we want to start intervening in creating a more diverse pipeline to recruit a more diverse workforce as biostatisticians and people in the STEM field, we need to start thinking about intervening at a much earlier time point than undergrad. I think we need to start thinking about doing this at the elementary time point. And so I've gone on and done it at the high school level. I've gone on and done this at middle school, and I think we need to start thinking about doing this in elementary school to, one, start making sure that we can create a more diverse pipeline, but also to get students to start thinking that math is not just plugging in numbers, but to see a more applied approach to mathematics and statistics, and to think that math is fun when they see it in a more applied setting. And so I think that if we do this, we can start creating a more diverse pipeline and start getting more people who have these health inequities involved in public health and biostatistics research, and getting these numbers up that we're seeing for PhD and master's students in biostatistics and statistics graduate schools to help improve this pipeline problem. Thank you.
Thank you, Dr. Hicks, and to all our speakers. I'd now like to ask if our speakers could join me on stage. We'll have a discussion now. We'll take questions from the audience, and for our audience joining virtually, we'll ask that you submit your questions using the Q&A function, and we have people here in the room who will read your questions to the panelists. So, thank you all. So let me start things off with a few questions. Dr. Bailey, you shared some of your personal story and how you got into the field, and maybe you want to elaborate on this. But I wondered if Dr. Hicks, Dr. Fayekas, you could share your own journeys into the field of biostatistics and any obstacles you faced and strategies that were helpful to you and supportive of you, particularly those related to diversity and inclusion.
You want to go first?
Sure. I was just talking to my SIBS students about this earlier today, so this is well. My students my parents were engineers, and so I was brought up with math and science pushed at me from an early age. They didn't know anything about biostatistics, but they knew that being educated in math and science were important. And so when I did my undergraduate degree at the University of Michigan, I thought that I wanted to be a dentist. And fortunately, though, I won't say poor advising, I just never reached out to my advisor. When I was in the summer of my junior year, I started shadowing a dentist and realized that I hate this. I was a senior, no idea what I wanted to do with my career. Finally reached out and talked to my advisor and realized that, Carol, well, you have the math major and you have the science major. Why don't you find a way to combine them? So blindly applied to some graduate schools in biostatistics, found a passion for it, went on to graduate school at George Washington University in DC. And this is my first time in the big city. I'd gone to undergrad in Ann Arbor, which was smaller, not as expensive. And when I was in DC, it was very expensive, and so I needed a way to kind of needed some spending money. And so there was an opportunity to be a teaching assistant. And so, never taught before, but I thought I can do this, so I applied. Again, a lot of poor decisions on my part, not really thinking things through. But I applied and was a teaching, and I loved it. Like, I absolutely fell in love with teaching. And so I decided to go on and get my PhD to be able to teach at the graduate level. And that's how I wound up at BU. And the rest is history.
Any regrets about the dental career?
No, none at all.
Okay, that's good.
So for a long time, I thought I was gonna be a mathematician, and my love. So I went to undergrad at University of Houston, and I really, really like algebra and number theory. That was my jam, and what I liked about it was a collection of puzzles, and I like puzzles. I like those theorems and proofs. That was my thing, and so that's, I thought that this is going to be my thing. So after Houston, I went to University of Illinois. I was pursuing a master's in mathematics there, and I remember filling out my schedule for my second semester there. 2 courses offered, but at the same time, I had to pick one. So I flipped a coin.
Scientific?
Very scientific. In a different universe, that coin landed in the other way. But in this universe, that coin landed in a way such that that class I ended up taking was linear models, and that person teaching it would eventually become my PhD supervisor. So we've talked a little bit about mentoring. So his name is Dr. Hernando Ombao, and so he's Filipino, and that's where things really clicked for us at the very beginning. And fun fact, he went to grade school with my mom's cousin, so there's also some weird things like that. But I've never heard of biostatistics until really probably that moment. I didn't know what it was, when I started, my parents were even asking me, "You didn't know nothing about biology. What are you doing?" But to me, I was, there was a man who, I could see myself being similar to a couple years down the line, and lo and behold, here we are.
All right. It seems like I might also need this. All right.
Yeah.
Yeah, so I also had no idea what statistics was coming out of my high school. Despite my math experience, I did like math. Like I found myself trying to, as I learned the material, because we weren't really learning it from the sub, trying to teach it to other students in the class, and I really liked that. And you know, I was not sure what people did if they liked math, but I had high school math teachers, so I was like, oh, I'm gonna go to college and I'm gonna be a high school math teacher. Thankfully, I talked to my high school teachers, and they said, don't teach high school. So then I continued with math as a major, but I didn't know what I was going to do with it. I needed money in the summers, so starting, not with my first summer I actually made cement and laid bricks for a summer, but my second summer, I was able to do an internship with the government. I was in Maryland. It was with the Department of Defense. And it was a bit miserable. I was just in a cubicle by myself, and every once in a while, my mentor would pop his head in and see how the coding was going. So that kind of eliminated, it was like an applied math thing, and I was like, okay, I don't know about all this. But going into my senior year, I was able to do a summer REU at the University of Wisconsin, which I appreciated in the summers, but they told me they go on the lake in the winters, which I assume is also a Minnesota thing. And I was like, okay, we'll stick with summer. But that's where I learned about biostatistics, right? It was a computational biology and biostatistics program as part of a larger STEM REU. But we got to meet with a bunch of biostatistics faculty and also current grad students, and they shared their own stories about how they ended up in the field. And it also, through the project we did that summer, it was fascinating that my math skills could be used to directly impact healthcare. So I was actually working with a pharmacologist who was doing end-of-life care and trying to figure out how do you space out the bolus doses, when you have the little clicky thing at your bedside. How do you don't actually get medicine every time you click the button, it's actually timed in some way. So how do you space those out to try to maximize pain relief without having any toxic levels of morphine in the blood? I was working on that, I guess I wasn't a teenager at that point, but man, I was young. And I don't know if it directly influenced his clinical care, but the idea that it could was just mind-blowing. And so that's how I ended up eventually figuring out, oh, maybe I should go to grad school. I went with statistics. I still didn't quite know what biostatistics meant, but eventually, even in grad school, I pivoted into a biostatistics program.
Well, thank you all for sharing that. It sounds like you really took it upon yourself to try things. You flipped a coin, you did the internship, which turned you in another direction. You found an internship that was attractive, but based on the data that you shared, we've got to do much more and more intentionally. We can't just hope that these good people find us, and somebody sparks an interest in them. So what can we do to find the students that we want in our programs? Because a lot of us we're all sharing the same interest and goal, but we need some strategies that we can apply and be more intentional and not just hope that the students show up that we want to show up in our classrooms and our programs.
So since I have the mic, I think about what I can do mostly in my workplace, in part because it takes up most of my energy, and that's where some days I feel like I live. But for me, I think I try to be intentional through advising, my first year advising, encouraging students to explore. I tell them about myself, I tell them about the field. Because even though I hear that, AP stats, for example, is much more common, I still have a lot of students who didn't take any statistics in high school. So they don't know what statistics is, and a lot of students come into Amherst College wanting to go into economics and consulting and be medical doctors. So I'm like, hey, do you know there's a really cool field called statistics? Let me tell you about it. But really it's more about trying to encourage them to explore with a little plug for statistics along the way. And then I also run, we also just started yesterday, the STEM Incubator Program, which again is more of a STEM exploration program. So I'm partnered with colleagues in chemistry and biology to give hands-on, basic research experience to students across multiple fields. This year we also have an astronomer on board. And again, it's a way to get students involved early, thinking about what it could look like to do research in these fields. and also build sort of a cohort of support along the way.
The three of us talked about early exposure, and I think that this is an extremely important thing. As I mentioned, I didn't know about biostats until, until after I graduated from undergrad. But even before then, I took AP Stats, hated it. I took a one-year sequence of probability and statistics during my undergrad, hated it. But that doesn't mean that that's what stats was. I mean, this is old school stuff, whereas stats is ANOVA. Stats is looking at the effect of treatment on crops, right? But now, especially even when we think about biostats specifically, it's not just clinical trials anymore. And this is where I'm really liking the term health data science, because biostats specifically is just so much more. And I think getting people exposed to that early on, that it's, the application of, certain techniques and looking at data in certain ways, that's data science. Yes, there's a bunch of math. Yes, there's a bunch of coding. But this goes back to, the brief anecdote I shared about robots. What's our analog of robotics for the data sciences? I mean, I don't know what that looks like, but I think that there are ways in which we can really inspire the young mind to really think about the data sciences.
I think one of the things that we need to do is having students see the more applied part of statistics. I think a lot of people that say, I took a stats class and hated it. And all you think about when you say you took your probability and stats classes, you think about how many ways you can pull socks out of a drawer. Well, of course you hated your stats class then. And so I think just making sure that students are exposed to the different applications of statistics, I think that's what gets them excited about it. And so I think it really comes down to, instructors making sure that they see the different applications and get that type of exposure early on. And I think that will help things. But again, I think exposure earlier will help in a high school setting. Like I said, and like I mentioned, getting them excited about math earlier on also will help.
Well, you gave the example about middle school. I was thinking high school, but middle school I think is a really good idea. And I guess it's just thinking about what are the applications that would grab the interest of those students. I certainly am way too far removed from them to be able to make that connection, but some of you could do it. And how do we find out what those applications are that would grab those students?
Yeah, so one of the things that I had to do was I reached out to certain middle schools and I talked to the teachers to try to see what units were you teaching and how could I tie in concepts and statistics to what they were teaching. And so when I found out they were talking about percentages and rates, I knew that I could tie in descriptive epidemiology and then tie that into statistics. But it's really difficult because you have to, with the public school system that is today, teachers are overworked, and so it's kind of hard to find a teacher who, ask them, oh, do you mind if we work in like a statistics unit on top of everything else that you have to do? Unpaid. So that's kind of difficult. And then there's a lot of, in the areas that I wanted to work in, there's a lot of high turnover. And so some of the teachers that I've worked with, you find out a year later that they've left the school system. So that can be difficult too. But when it works out really well, it works out really, really well.
I bet it does, yeah.
These are not my ideas, but I was just in a webinar on a similar topic on Friday. And the other two panelists there, I think also were thinking about these things. How do we get into high schools? I don't know that they went down to middle school, but some of it was generating their own data, or playing with fun things. So even Jackie, you were talking about the M&Ms thing. We did that at Ohio State even for our undergrads, and I enjoyed M&M Day as well. But they make these like catapults that you can launch things, and like what kid doesn't like to launch things across a room, right? And then talk about variability in the distance traveled. And then Casey Tan at Memorial Sloan Kettering actually has a program partnering with high schools in New York City And I think they try to squeeze in just an hour and a half doing things related to data. So I think they present different pictures, images, and they tell people to try to guess the age. And so in real time, they're populating the kids' guesses, and they get to see their data, and then again, talk about estimation and variability. So some of it might not necessarily be about knowing exactly what the kids think is cool, but rather playing, literally just playing, having fun with it.
Yeah, my advisor's daughter was a 5th grade teacher, and he encouraged me to go into her classroom, which I did. This was many years ago. And I had the kids, I brought the CDC growth charts and some tape measures, and we were doing head circumference and height and looking at where they fell, you know, in the percentiles they were for their heights and head circumference and things, and the kids thought it was fun. They were measuring things, and, you know, no matter what percentile they turned out, they thought that was the best one to be. So it was good for everybody. Can we shift to a comment that you made, Dr. Bailey, about belonging? How do we create environments, and your comments went to that too. How, if we get the students we want in the programs, how can we best support them and make sure that we retain them throughout their programs? Because I think the worst thing that could happen is we get a diverse body of students and we lose them. That would just set us in the wrong direction. So what can we do specifically to create the environments that support all students?
The most obvious thing is the mentorship. And I think, however, that even though it is obvious, it's also not sustainable. There needs to be more. And because there needs to be a broader infrastructure in place. You know, I don't know what that infrastructure looks like, but regardless of who you are, what you look like, whatever your identity may be, you should not feel alone. You should be able to find someone, whether, you know, amongst the faculty or whatever, you know, someone in the program whom you could just feel safe around. And I think that that's, you know, that's touching on the mentorship, but, you know, what about a system in place for that? Now, again, I don't know what that looks like. And this is, you know, I've benefited a whole lot from that, from my PhD advisor. And then, you know, after graduate school, you know, while he and I maintain contact, and even to this day we still maintain contact, you know, having, you know, some support still comes a long way. Now I have a lot of mentors. I have a lot of, you know, people who are cheering me on as I progress in my career. But, you know, when it comes to very specific things, say about myself and who I am, you know, should I have to explain to you why, you know, when it's, you know, Manny Pacquiao's fighting, why the night is stopped for me? I shouldn't have to explain that for you. You know, you know, my advisor certainly understood, and we were watching together. But you know, or you know, when you know, when the big volcano erupted a couple of weeks ago in the Philippines, you know, if I am a little bit disturbed, you know, someone will be able to understand that. And I mean, again, I'm talking a whole lot right now about mentorship, and I think something that we could really think about as a field is, what is beyond that? And because whatever that may be, I think that we need it.
Mm-hmm. Mm-hmm.
I agree. I think it's hard to think about like broader systems in place. I will give an example, at least from the program that we run. Again, the STEM incubator, one of our goals is really thinking about the cohort building, in part to think about how can we ensure these students at least have each other, and maybe whatever we're doing in this space will expand beyond that and into the broader Amherst community, and maybe they carry these skills even beyond Amherst itself. But at Amherst, we start by actually just like listening to the students. What is it that they need from us? So yesterday, for about an hour, hour and a half, we started our summer program with what we call Community Circle. and we develop a sense of community values. So every student, we have like a list of potential values, words that reflect values they can add to the list if they want. And we have everybody share, like, what is it that you value in terms of thinking about having a supportive team, a supportive community, and embarking on this journey together this summer. So everybody gives like a value in their reason. And then we break into smaller groups and try to build a community values statement that we hope to live by for the rest of the summer. And through that, it's not just what do you value as a teammate, but also what can we do to support you and your learning in this program. And those things don't just apply in that small space, right? I hear those things and I'm thinking, oh crap, what do I need to do in the classroom to ensure that I'm meeting the needs of these students as well? So I think it starts with listening, but again, that's easier to do in this smaller setting. We only have 18 students in this program. What does it look like for the 2,000 at Amherst College? What does it look like for the thousands, in school across the nation, or just across the nation generally? It's harder.
Yeah, I know it can sometimes feel like an insurmountable task. You say, I don't know what the systems look like. I don't know how to even tackle this. But I want to think that every little bit helps. And I think one of the biggest issues, I don't know if you would agree, is accountability. I think we all have a responsibility, and we have to be accountable. We can't say, oh, you're really good at this. You do it, and I'll just sit in the background. That's not going to work, right? And so I guess maybe even among faculty and staff, we need to hear and share our values, make sure, instead of just assuming that we're all on the same page, because this takes work. And we're not going to change those numbers that you showed us unless we all commit to it and are all accountable to it.
I agree with that, and I will also add on that one thing that's also important here is investment. Mm-hmm. We can spend all this time trying to support students, but if we are not properly, let's just say, compensating the faculty to do so, you might want to look as a division, as a department, on what you are truly valuing. Mm-hmm. To kind of give you an example, I mentioned about the RU program that I have. I am supported on that 1%. I will just leave it at that number.
You don't have to say more. Let me open it up to any questions here that any of you might have, or any questions from the virtual audience. Yeah, Erica, please.
So this question is from Anita, who helped organize this program, actually. And Anita says, it's clear that engaging and recruiting students from underrepresented communities takes faculty effort, organizing conferences, outreach to K through 12, et cetera. What is the support for this effort? Is it part of general faculty service? Is there specific support for it? Is it valued for promotion?
That is the question.
Well, I already put in my 2 cents on that, and no pun intended. I'd like to be more than 2 cents.
I feel like our chair should come up.
Yeah.
So I've gone to some of these conferences where we've tried to recruit students, and the department and school has been supportive. They've supported my travel there, and they've supported us in our efforts to recruit students. And we have our graduate program directors who have also supported us in our efforts to try to recruit students. So, yeah.
I'll speak to this as a junior faculty member, pre-tenure. And I feel like the message generally is that, yes, we value this work. It's really great. We love the product. We love the results, the outcome. But also, you need to be focused on your research. Your research is still, first. It's king when it comes to tenure and promotion. But I do this work despite, in part because I am the only Black woman in my department. I think there might be 5 Black STEM faculty. I'm probably undercounting, I'm sorry, Amherst College. We have done a lot to diversify the faculty, but there's still just not many faculty of color at Amherst College yet. Our student body is incredibly diverse, but the representation in faculty and staff is just not quite there yet. And I feel called to give back, to give back to students in ways that people invested in me. So I don't know how to not do the work. I have tried to opt out, and then I find myself back in very quickly. So I think I'm doing it despite and trying to make sure my research stays strong on the side, and still a priority.
To build off of that, it does remind me of the impression I have is that the faculty of color are feeling compelled to do so. I do challenge those who don't belong in such groups to also feel compelled to do so.
Mm-hmm. I agree, because it's an awful lot. It's a disproportionate lift, and that's not right. That's not right. Others, questions? Yes, please. Well, please use the mic so that our online audience can hear you.
Hi, thank you panelists for the wonderful discussion. As an early career person and person of color and international, I feel like a lot of concerns or questions around other educational and professional development opportunities, such as going to conferences or taking parts in like boot camps, which I haven't at least seen a lot for biostats. So I'm just wondering if that is part of any of these programs that you mentioned, or it is going to be in the future. I don't know if this is an idea or a question at this point, but I see a lot of like funds going into science, medical science, but not a lot into biostats. It's either computer science or medical, and like the biostats is kind of like hanging in the middle. So I'm just wondering, like, what are such opportunities that people can look into, or if you have any suggestions?
So are you looking for opportunities for undergraduates
Well,
or
at all levels.
faculty?
Well, at all levels, I feel, because coming into grad school, I had no idea where I was going. I just knew I liked biology and maths, so I just blindly applied for biostats, and it worked out for me. But a lot of students reach out to me, and I have no answers for them because I myself don't know. So I'm just wondering, like, at any level, if there are, as data people, is there a repository that we can either build or kind of look into that exists already?
So do you want to talk about SIBS and many of the initiatives that you're involved with at ASA? Yeah, please, go right ahead, start.
Sure, at least for undergrads, well, I can't speak about our SIBS program, but we did have a SIBS program. That was a one way to get people involved in. SIBS is NIH funded, and in my case, it's an REU, which is NSF funded. But the idea is similar, but again, the target audience there is undergrads and getting them exposed to research in the statistical sciences. For faculty, I don't know, and maybe the other two here may have an answer, but at least for undergraduate students, I think they have SIBS and REUs. I will also say regarding your comment about computer sciences, I feel like that we are now in competition in some sense with the computer sciences. Especially this idea of data science, right? It has this very broad definition, and everyone wants a piece of the pie. If we as a field of biostatistics really want to make ourselves distinct and really encourage people, then we should make a lot of effort on creating the distinction on this is biostats and health data sciences, this is computer science, this is whatever other data-centric field.
Mm-hmm.
So if you have people who are interested in the intersection between math and biology in their undergrads, I would highly encourage them to apply to SIBS. There are 10 sites now. Mm-hmm. These are 24 SIBS students now for BU. But yeah, so it's right now we have a 5-week in-resident program and then a 5-week remote program where they learn about biostatistics and its applications to epidemiology, clinical trials, statistical genetics, and infectious disease. And then they work on a research project where there are research assistantships with a stipend. And yeah, so we can talk more about it. They do, there are different sites, and then there's different REUs throughout the country. There isn't a repository, which is unfortunate, but there are some other sites that I can point you to, and we can talk more about this later. But yeah, so definitely talk to me.
One of my favorite things to talk about are the opportunities available through the American Statistical Association. I have been involved in the Committee on Minorities and Statistics. I'll call it since 2017. As a grad student, I was on a panel at StatFest, a grad student panel talking about our experiences as grad students. But the point is, there are two major initiatives of COMIS. One is StatFest, and that's geared towards undergrads. It's every fall, September 21st at Columbia University this year. And so for StatFest, it's mostly about exposure. At least the first goal of StatFest is exposure. We have career panels to try to, across like academia, industry, government, to try to let students know about what the variety of opportunities are like in statistics. We have a keynote speaker who's a little more seasoned, who can talk about their own sort of winding pathway through the field. We have a StatFest Expo where we have grad program representatives there. We have industry representatives there to tell students about opportunities and have that personal connection with them. And then the highlight of the day is usually a closed session with grad students and students only, where again, they get to hear more about what it's like to go to grad school, what the application process is like, what the lived experience is like for these students in the field. So StatFest is geared towards undergraduate students, but depending on where we are and the capacity and sort of like liability things around the site, last year at SAS, we actually had elementary kids there, and we had high school students there. So we could address that sort of early exposure and learning about what are the many different opportunities in the field. And then for those who have already identified statistics as something that they want to get into, we have the diversity mentoring program, which also has some aspect of exposure. There's still people from different career fields who might talk about their experiences if you're still trying to figure out as a student, as a grad student, or perhaps even as a postdoc, or even early career with transitions, thinking about what is it that I want to do going forward with this degree. And a major part of the diversity mentoring program, which is attached to the joint statistical meetings each year. I'm not going this year, so I can't plug the dates, but you can look it up.
August.
But the mentoring component is key there. So we have sort of mid-career and later career statisticians partnered one-on-one with students, postdocs, and early career statisticians. And they meet every morning during StatFest is on the brain. During JSM, they talk about what it is to be in a mentoring relationship and how do you make that mentoring relationship successful and lasting. And so they have that one-on-one sort of, I guess I would call it bonding time. But the intention is that these are long-term mentorship relationships. And not only that, beyond the one-on-one, they're having small group discussions and larger group discussions to also build community among the people there. So we tend to see return applicants within DMP and StatFest as well, because as soon as you come into our program, we say basically like, welcome to the family, right? We are here for you. Even if I don't get a chance to talk to you when I'm physically at StatFest, you know my email, you know how to find me, like I wanna be there for you. And having that community of people to serve potentially as mentors, but also just as peers, going through the stages of life together, going through the stages of your career together, right? We want to make sure you have a community and network to fall back on.
Great. Other questions? Yeah.
Thank you. Hi, thanks everybody for that. I have a question sort of going down this idea of, sort of thinking more creatively about the diversity pipeline, and so and people who know me well know that this is a hill that I'm going to die on. I think there are structural things that we can sort of rethink, the qualifying exam being one of them. And I think evidence for that might be perhaps like, everybody, I think in graduate admissions thought that we could never do admissions without a GRE score. COVID gave us a natural experiment that said, actually, we can, and everybody survives, and a lot of places are not going back to GRE scores. So I'm wondering if you might have some thoughts about sort of other structural things that sort of, getting to this idea of inclusion and belonging that sort of, I think the way we do graduate school and the way we do sort of our programs are defined around, like we expect students to come in, fit in with our model, and we provide them with support that basically assumes that they're going to assimilate to our structure. And I'm wondering if there are ways that we can sort of think about expanding, being more flexible around what that structure might be, the qualifying exam being one of them. Thanks.
We're thinking.
No, I mean, I think it's a really tough question, and I don't have answers either, but as soon as you said qualifying exams, like, ooh, right? They're a bit traumatizing. They're such high stakes. And this is speaking as somebody who failed the first qualifying exam. We had 2 at Ohio State. Failed the first qualifying exam, and by the time I went to retake it, I was almost hoping I would fail again, just so a decision was made. Because when I passed, then I had to be like, dang it, that second one is coming up. Do I really want to stick this out? So qualifying exams can be really discouraging and really high stakes. And for me, I did feel like it wasn't assessing my ability to do research in this field. But on the other hand, I also, to some degree, I understand why they're there in the sense that you need to know this stuff, and you're not necessarily showing you know it. I mean, I don't know. I'd like to believe you're showing you know it in the classroom. But is that always the case? I don't know. It's a complicated question, but I also just generally don't like them. Are there other ways that aren't timed exams even that we can do this? If we feel like we have to have some sort of assessment, is there a more creative way that we can go about it to show what it is that we're trying to show, especially for the doctoral level?
Yeah, so this is a really tough question, and I mean, I'm just going to throw something out there. You did say creative. When it comes to evaluating a potential, an applicant into your grad program, you mentioned GRE, but what about GPA? Especially since, these things are not exactly comparable across institutions. And what makes it tough, right, is that, I mean, I'm certainly not saying that we should get rid of GPA altogether, but is there a way in which we can look at, quote unquote performance, and I'm going to use that very loosely, be able to evaluate and assess students' past performance in order to forecast their future performance? I mean, I don't know how we could be creative around that, but the GPA is one of those where, I mean, to be honest, like when I look at some institutions, like, okay, yeah, 3.6 here, that's actually great, but a 4.0 there, I mean, all right, that's all right, but why am I doing that, right? And so that's a question then that, that we, that perhaps I should also reevaluate, because really this should be objective. And that's what the GRE was supposed to provide us, some standardized way. But I mean, I don't know. But I'm going to throw GPA evaluation as one of those things.
Yeah, and I understand what you're saying about qualifying exams, because some students simply don't test well, and you put them in a stressful environment, an anxiety-inducing situation. And I've seen students, even in not just in my intro level core class, just break down, and it's an awful situation to have to put them in, and to have your entire PhD academic career just set on on one exam, just an awful situation to be in. So
yeah, I think that it's time to open the conversation about what are other ways we can evaluate students, and just because we move away from something like the GRE, which we moved away from, and as far as I can tell, we're not bringing it back. And it didn't, nothing bad happened. Nothing bad happened. We still have excellent students. They're doing just as well as they always did. There were no issues. I guess we have to stop thinking that if we take something like qualifying exams away, that means our program doesn't have integrity or something else. It's not the case. What are other ways? I mean, what was the purpose of them? And you were saying, you know, maybe there is a role for students to be able to demonstrate what they've learned, apply what they learned in a course in a different setting. That's okay, if that's important. And what are the other ways we can assess these things? Because they don't work for everybody. And so I think the time is to open the conversations. Why not? Other questions? You have a question, Erica? From online. Yeah, okay, great. Yeah.
Arthur asks, what are your thoughts on the other end of the biostatistics pipeline and lack of representation? By that, I mean the actual research and research funding landscape. It can be demoralizing and alienating to see how little attention certain populations or disease areas get.
Yeah, can you repeat?
What are your thoughts on the other end of the biostatistics pipeline and lack of representation? By that, I mean the actual research and research funding landscape. It can be demoralizing and alienating to see how little attention certain populations or disease areas get.
Yeah, that's an excellent question, and there's actually a couple of ways I can interpret that question. One of which is the people that we are studying. Another interpretation is that who are getting the grants. So but let me talk about the first one. I mean, this is tough because at the end of the day, right, we want to be able to talk about science and how the results that we get are not are applicable to more than just the white educated. That's what we want to do. But yet, when we think about who are the people going into the studies, guess who has the time and the resources to be a participant in said study? So that's just the people. I can't speak about the diseases itself, but at least with respect to the people who are participating, I think that outreach into really encouraging people to be part of the process, and this can be tough when there is history, between say certain groups of people and the federal government, and something that I think that we should be mindful of when that you don't just go to when you are recruiting study participants. I already forgot what the second interpretation was, so I'll just leave it at that.
Anything else to add? Okay. Other questions? Oh, go ahead. Yeah, go right ahead.
So this question is from Patricia, who is a SIBS 2004 alum, and asks, as an alum of BU-SIBS, what can we do to support the next generation of biostatisticians entering the workforce? How can we support the future of the SIBS program in the next decade?
Jackie, this one's for you.
So we're always looking for alum from SIBS to participate in the SIBS program. So one of the things that was talked about previously was mentorship, and I'm always telling our SIBS participants, the SIBS 2024 program is not just 2024. We will be mentoring these students for many years to come, whether that be course selection, letters of recommendation, trying to help you determine what graduate school program to go to. And so what that entails is we might be reaching out to our SIBS alum to be like, have any of you attended maybe like North Carolina Biostat program? Could we have a student who's interested? Could you help us out? We have a student who's interested. Could we put you in contact with this particular individual? So things like that. Or we have a student who's interested in clinical trials, could we reach out to you to put you in contact with this individual? So help with things like that, just little things like that. A quick Zoom call with the past current SIBS participant would be really helpful.
Excellent. Are there any others from online?
This comes from Carissa. I noticed some decisions are driven by the need for income. I also had that challenge. What could be a more intentional way to inform the reality of supporting yourself as a student or moving from other jobs to academic jobs?
Not sure, but can you say that one again? I'm not sure I grabbed that.
I think she's talking about so some of the decisions, I guess, of potentially the career paths are driven by the need for income. And I also had that challenge, what could be a more intentional way to inform the reality of supporting yourself as a student? So I guess just thinking of potentially economic factors that are driving decisions in terms of education paths is my interpretation, at least, of the question.
I mean, I can comment. I was broke as a student, especially one living in Boston. I had 2 roommates the entire time and lived outside of Boston and commuted in on a regular basis. So, and I mean, I get it. You don't want to make these decisions based on the economy. And so I found a way to make it work. But, I think that universities are getting better at recognizing, particularly at BU, at recognizing the economic factors that are driving these student decisions. They've raised the research assistant stipend, which is great. And so I think universities are coming around to that. So that's been really helpful.
Yeah. Anything else? All right, well, we are just about time. I want to thank again Drs. Bailey, Fayekas, and Hicks for joining us this afternoon. We're now going to take a brief break and reconvene at 3:45 for session 2, which is a discussion with our alumni of our SIBS program that will be moderated by Lori Chibnick, Associate Professor of Neurology at Harvard Medical School and Harvard T.H. Chan School of Public Health, and Adjunct Assistant Professor here at the BU School of Public Health. Thank you all very much. We're now going to shift over to panel 2, and I'm going to ask Lori Chibnick to come to the stage. She's going to moderate this session. Lori and I actually started the SIBS program. She may tell you a little bit about that. Lori is, again, Associate Professor of Neurology at Harvard Medical School and Harvard T.H. Chan School of Public Health, and she is an Adjunct Assistant Professor here at the BU School of Public Health. She's going to introduce our panelists, who are all SIBS alumni, and lead the discussion. Lori, thank you.
Hi. First, I just wanted to say thank you to the Dean's Office and Lisa, who was not just my mentor in SIBS, but my thesis advisor, and she managed to survive that somehow. She's a very strong woman. So I'm going to start by giving a little bit of a background on the SIBS program, just to set the scene. So as mentioned earlier, in 2004, NHLBI put a call out for a training program to increase the pipeline of just people in biostatistics. And 3 programs were funded: BU, North Carolina State, and University of Wisconsin. And ours were, I have to say, every 3 years, this faculty here at BU really got together and was able to keep funding it up now for 20 years. So the original schedule that we had stuck with some enhancements over the years. So we started with about 2 weeks of biostats led by Lisa, and SAS led by Howard, who is still working quite adamantly about getting everybody up online with SAS. We had guest speakers from the outside, Dr. Apovian from BMC, director of the Weight Management Clinic, and she discussed risk factors and treatment for obesity. Dr. Kim Dukes from DM Stat, now at BU, invited the SIBS students to DM Stat to meet her team and discuss the importance of data quality and data management. Many other faculty, Michael Pensina, who was in math and stats, Alexa Beiser in biostats, Adrian Couples in biostats, came and shared their personal pathway and their personal stories on how they got into biostatistics. We then went to epidemiology with Wayne, and we had Pat Clute from the Department of Public Health talk to us about an outbreak of food poisoning at a wedding. Lunch that day was very interesting. Professor Glantz talked about evidence and ethics and how to think critically. Professor Bill Bicknell, another favorite, and former commissioner of public health for Massachusetts, talked about some of the issues he's faced over his career. Next was on to clinical trials with Joe Massaro, a consummate fan favorite. We had Ralph D'Agostino discuss his illustrious career in clinical trials and working with the FDA. And then we had a field trip to HCRI, which was kind of a CRO that Joe loved to take everybody around and show him all the places that they work. Finally, we switched to statistical genetics with Anita, who is here today online. And what really started a very, let's say, friendly rivalry between clinical trials and statistical genetics. It was the Joe versus Anita. This has continued for 20 years and has even bled into the Yankee swap in the biostat department. We also had Diana Bianchi come and speak. She was a medical geneticist at Tufts at the time. She now directs the National Institute of Child Health and Human Development. However, one of the best aspects of the SIBS program, at least from my perspective, was its focus not just on science, but on building community, something that's been spoken about by some of our speakers today. Throughout the program, the students lived together in the Bay State brownstones, which had no AC, so they were very dedicated. They were joined by the faculty and participating in many social and community building events and activities organized by Mary. They got to know Boston, first with the trip to Faneuil Hall, with Lisa insisting on getting cookies from the Boston Shipyard. I highly recommend it. Then a duck tour and a freedom trail, and although we had always had costume guides, Mary, Lisa, and I usually managed to throw in a few sort of accurate historical facts along the way. We toured the Framingham Heart Study, heard from Dr. Bicknell, who was one of the original investigators. We took a trip to George's Island. We saw Wayne on his boat, and of course took in a Red Sox game, although no Yankees fans were allowed per Mary's orders. We always ended with our 6 weeks with a dinner that included the faculty at Lucia's in the North End. With all that we were able to squeeze in just 6 weeks and the community that SIBS has really built over the year, I think we earned our moniker of Statistics Camp. So to all of you guys, welcome to Statistics Camp. Our faculty and staff were so impressed with our students, they kept applying to continue the program, so 20 years on. Our primary goal was always to run an interactive program to introduce undergrads and recent graduates to biostatistics as a vibrant, vitally important discipline that offers exciting career opportunities. Some former students once told me that they considered SIBS a 6-week advertisements in biostats and public health. So I think it worked. Many of our SIBS graduates went on to further study in biostats or epidemiology, focusing on clinical trials, statistical genetics, staying in academia, many going into industry or government positions. Before we hear from our panelists about their experience in SIBS, I want to offer one personal reflection. So I was a first-year PhD student here at BU in the biostat program when SIBS got funded. I will always remember the first time that Lisa told me about the program. She told me all about this program that they had submitted. They were waiting to hear if it got funded. And my response was, oh, that sounds like camp. Now, I don't think that that was the response she was expecting. But yet, she still asked me to be involved. So that's how I ended up managing the program throughout my PhD and has stayed quite active as I can with the program thereafter. That conversation for me was a turning point in my career. So many of my choices, my priorities have been driven by my time in SIBS. What I learned from the faculty and students of the program, I have carried forward. And everything that I have built since in terms of training programs and mentorship, I really owe a lot of credit to the SIBS program. So on that note, I would like to turn it over to our SIBS alumni to share some of their experiences. I will start by introducing them in the order that they are sitting. So first we have Taylor Mahoney, who's a senior statistician at Avania, a CRO focused on clinical trials for medical devices. She participated in the SIBS program in 2013. She received her BS in Biostatistics from Simmons University and her PhD in Biostatistics from BU. Her research interests include stat methods for adaptive clinical trials and analysis of correlated data. Next, we have Allison Pedley. She's currently the Chief of Staff at Merck's Biostatistics and Research Division Sciences Organization. In this capacity, she leads the organization's leadership teams in advancing organizational, operational, and strategic initiatives. Allison earned her PhD in biostatistics at BU School of Public Health in 2010. She joined the Late Development Statistics Group within BARDS at Merck in the fall of the same year. And Allison was a participant in our inaugural 2004 SIBS program here at the School of Public Health. Next, we have Jamie Collins, an associate professor of orthopedic surgery at Harvard Medical School and the associate director of the Orthopedic and Arthritis Centers for Outcome Research at Brigham and Women's Hospital. She's the director of the Biometry Consulting Unit at the Department of Orthopedic Surgery at Brigham and Women's Hospital, director of the Brigham Coordinating Center's Data Management and Analysis Core for the Arthritis Foundation Osteoarthritis Clinical Trial Network. She received her PhD in biostatistics from Boston University School of Public Health and was a participant as well in the inaugural Summer Institute for Training in Biostatistics at Boston University. And then we have Greg. So Greg Sandoval. Oh, sorry. Okay. Greg Sandoval is an assistant research professor of biostatistics and bioinformatics at the George Washington University Biostatistics Center. He is currently a co-investigator at the Eunice Kennedy Shriver NICHD Maternal Fetal Medicine Network and is also a principal investigator of the Data Coordinating Center for the NHLBI-funded cord clamping among neonates with congenital heart disease trial. Dr. Sandoval participated in the BU SIBS program while he was an undergraduate at the University of Texas in Austin. He continued his education at Boston University and received an MA in biostatistics. After a period of professional work in clinical trials research based in Cambridge, Massachusetts, he moved to Washington, D.C. to pursue his PhD from the George Washington University. So thank you all for being here, and some of you coming from out of town to join us. I would like to start by asking our SIBS alumni to offer some reflections on their time in SIBS. Tell us when you were in SIBS and how that might have affected your career. Taylor?
Okay. Hi, so that's loud. I'm Taylor Mahoney. As Lori said, I'm a senior statistician at Avania, and I did the SIBS program in the summer of 2013 after my sophomore year at Simmons. And I think for me, if it hadn't been for SIBS, I wouldn't be sitting here. Is this working?
Yes.
It is? Okay.
You're good.
I think for me, if it hadn't been for SIBS, I wouldn't be sitting here today. I was fortunate enough to go to a college that had a biostats major, but I picked it just so I could not major in biology. I knew I liked math, I knew I was good at math, but I absolutely hated zoology, so that was my turning point. But yeah, at SIBS, just the support of the faculty, even to today, I still talk to Howard and Lisa, Lori, Anita, all of them. They really showed me how much they loved their career. They loved what they were doing, and they cared so much for their work and for the students. So that, for me, was enough to make me want to go into biostatistics and do it here with them.
Hi, everyone. My name is Allison Pedley. As Lori mentioned, I'm a biostatistician at Merck, which is a pharmaceutical company. I was, as Lori also mentioned, one of the first participants of SIBS back in 2004, which is really embarrassing for me to say is 20 years ago, because it doesn't seem like it's been that long. But I remember very, very clearly being in your exact same seats, and I'm so happy for all of you that you're here and getting the opportunity to learn about biostatistics this summer. For me, this was a pivotal program in my professional career, and something that's been really important to me ever since I left the SIBS program. For me, I was at a small liberal arts college studying mathematics and not really sure, like other people up here today have mentioned, what I was going to do with that. I considered being a math teacher, and I love teaching, but I knew that wasn't quite the right fit for me. I also love medicine. I spent the summer that I came to Boston here also doing a summer program at Penn State Hershey Medical Center in Pennsylvania, because I wasn't sure if I wanted to go into medical school or not. For me, biostatistics was the marriage of two fields that I felt really passionate about, math as well as medicine. And the opportunity to come here and learn about what biostatistics even was opened a lot of doors for me in terms of where I could see my career going. It was really cool to learn from all of the professors in the program about what it was. And then for me to also see that pharmaceutical career was something that was possible. I didn't even know what biostatistics was before I came to the program. And finding out that it was something that I could go to school for after leaving undergraduate was something that I found out about here and set me on the pathway to where I am today.
I'm Jamie Collins. I'm a biostatistician at Brigham and Women's Hospital, which is just across town. I always loved math, and I always was really good at math, and I was actually one of the fortunate few who was lucky enough to take a biostatistics class as an undergrad, so I sort of knew that's what I wanted to do. The problem was, like, where do I go from here? How do I learn more about this? And I think, Dr. Bailey mentioned in her remarks sort of this access to opportunity and how important programs like this are to open the door for people to kind of get opportunities to learn more and begin to network and start a career in this field. And my kind of funny story was, I was a junior, I was an undergrad, I knew you were supposed to sort of do an internship or do something so that you could get a job when you graduated from college. And so I didn't really know, how do you find an internship? And I think, the unfortunate reality is a lot of people find internships because their mom or their dad or a family friend or somebody else knows somebody who can get them an internship somewhere. And if you don't have those connections, what do you do? How do you get a foot in the door? I actually went to career services at my undergraduate institution, which I shall not name, and asked, I said, I'm really interested in this field of biostatistics. Again, this was 20 years ago, so it was sort of less well known than it is now. What should I do? How do I get an internship? And the advice that I got was, well, why don't you try just calling some hospitals and seeing if they have internship programs? And I said, you mean like take out the phone book, because we were still using phone books back then, look up the number for Brigham and Women's Hospital and call it and ask the person who answers the main line at the hospital, do you have biostatistics internships? That was the advice that I got from career services. So I was trying to find a way to, not have to go back to my hometown of Buffalo and work at a grocery store over the summer, which is what I usually did. And I didn't really know what else to do. I got pretty terrible advice from career services, and then got really lucky and kind of at the last minute heard about this opportunity for SIBS. And through there, I got my first job. Instead of coming back to campus at the fall and working at the coffee shop that I worked at during the school year, which I think is like a slight step up from the grocery store, I don't know. I actually got a job with Dr. Kim Dukes at DM Stat, who was one of the people we met over the summer. Got my first job as a statistical programmer. Allison ended up working there too, as did Dr. Gina Peloso, who's here, so we have a mini DM Stat reunion. And so, through there, I got sort of my next job in academia, decided to go back for a PhD, and so, I sort of tried on my own to see how do I start this career in biostatistics, and kind of ran into this brick wall of the phone book of calling hospitals, and got really, really lucky with SIBS that opened all of these doors for me, and I just feel so fortunate to have been part of the program and so passionate about programs like this that can do that for other people.
I didn't consult the phone book, but I went to Dr. Google, and I looked up the program at the time. I went to a large university, but they didn't have a statistics department at the time. And I was interested, I was an undergraduate mathematics major, always interested in medicine, as Allison, similar to what Allison's story is. So I wanted to find a discipline. I also took AP statistics in high school. So I had some exposure to statistics from that experience, but I always wanted to mix the two. And biostatistics, Dr. Google, SIBS came up, surprisingly, and I saw that there were 3 programs, and I applied to all 3. Also at the time, I was a rising senior at my previous university, and I also applied to an REU. Speaking of REUs from the previous panel, I got accepted to that and the BUSPH program. People that I had consulted with and looked up to in the sciences were like, go to the REU, because it was more prestigious at the time, to be honest. It was only the 3rd year that the BUSPH program was going on. But I always just remembered, like, my decision was, like, I was always interested in the interdisciplinary aspect of the medicine, public health, mathematics, statistics. And so I took a shot and accepted to go to the BUSPH program, and I'm really glad I did. It set the foundation for where I'm at right now. They're at the forefront of what they need to teach kids and students what was applicable and relevant today. At my time, it was statistical programming, and that skill I use every day, and it's very essential to your education and through when you apply for jobs. The SIBS program also allowed me to tap into a network, as Lori was mentioning. Once you leave the program, you can always reach out to them, and they'll help you with job prospects or other university graduate programs. And so that's how I found about what the SIBS program and how I got to where I am.
Okay, is this on? It's on. Okay. So there's been a couple of themes in the conversations that we've had today, and one of them, of course, is getting people into the pipeline, and another is keeping people in this pipeline. So I want to pose a question. So SIBS, as we've heard, has opened many doors for you. What were some of the things that were available to you post-SIBS that allowed you to continue in the field, and things that were important, if they didn't exist, you might not have been able to continue? If you would like to, you may start, yes.
For me, after I did SIBS, I did another summer program the following summer at the Harvard School of Public Health in their Department of Biostatistics, which was similar to SIBS, and it was just another way for me to meet, sorry, Lisa. It was another way to meet more people and more people doing biostatistics. But another piece that doesn't have to do with another school. I did an internship with Lori in statistical genetics, because after SIBS, I was all about statistical genetics, and I don't do that now because I went into clinical trials. But without SIBS opening those doors of, how do I find these other opportunities? What is graduate school? Because for me, similar to Dr. Bailey, I came from a low-income, single-parent household. I was the first in my family to go to college. And so I had no idea what I was even doing at SIBS. I felt so out of place, but the faculty just, they really helped me realize, what a master's degree was and what a PhD was, and they just were always there to support. And so without doing SIBS, I wouldn't have known about these other programs and internship opportunities.
Yeah, I think for me, the mentorship that everyone talked about today has been really critical for my pathway. Coming here in the summer and seeing the people who came to speak with us, the professors, they were real people with great careers that were friendly. They weren't off of a page and on a website telling me about something. They were real people that I could relate to, that I felt like I could do the same things that they were doing and give me an inspiration to go on that same path. And then post the SIBS program, connecting and having help even from Lori with my graduate school applications, and from the staff to get into the program. And then once I got here, the job at DMStat that Jamie mentioned, lots of connections along the way, that the connections in SIBS really helped me set up for myself. So lots of mentorship, lots of help, lots of support, and lots of feeling like belonging.
Yeah, all of those things that Allison just said. Yeah, I think, like I said in my story, you try to do all of the things that you're supposed to do to get a career or to get on the path to graduate school. And I think, unless you're lucky enough to have somebody in your life that sort of knows those ropes, it can be really challenging. You can really try your best and still, run into to roadblocks. And so again, just this community of knowing people, of having people to ask questions to, of how many people, Lori, have emailed you and said, well, I'm thinking of going to graduate school. Do I want to do an MPH or do I want to do a master's in biostat? There's like not all that many people in the world who can give you good advice on that question, do I want to do a master's or do I want to do a PhD? Should I take a little time off first? What are my next steps? And just having this whole community of support to ask that question to. And if Lori doesn't know the answer, or if Jackie doesn't know the answer, they'll know somebody who you can talk to help you figure those things out. And it's just been, so helpful to feel like there's this whole community and, all of these mentors that you can lean on. And I think all of us want to be the next generation. And so, any of you that have these kind of questions or these dilemmas, we want to be here to support you all too. And I think that's been, a really big legacy of SIBS, is not just kind of raising the next generation of biostatisticians, but kind of raising the next generation of mentors that also want to give back and give the next generation the same support that we got.
I'll echo everything, but I'll tailor it to my story. I think, well, one aspect of the SIBS program that I really liked, and I kind of always impart this to everybody that always asks me, like, how do I get to where you're at? I learned by doing, and a lot of the activities that we did during SIBS is you learn by the lectures and you apply it through the activities and the programming, and it really reinforces that what they're teaching you. And so one of the resources that I took advantage of when I was a master's student at BU was the scholarship research, the GRASP, the Graduate Research Assistant Scholarship Program. And at the time, I was really interested in clinical trials. I still am. And Joe Massaro linked me with a small CRO in Cambridge called Prometrica. And that was my first job. That was my internship while I was in grad school. And lo and behold, when I finished my master's degree, I ended up staying there for the next 7 years, and it was a very fulfilling career, but I was always learning, and I took classes. I went back to BU, wasn't sure if I wanted to do a PhD. I still went back to school and took classes, and I still had the aspect of going to work. But that's one of the valuable things about the SIBS program when you leave, is that network that's open. Really tap into that, take advantage of that. I guess I'll end at one point is, it was interesting because the SIBS program when I was a participant was primarily funded by NHLBI, and now that investment that NIH has really came through because now I'm a PI of an NHLBI study. So that's a really great investment, and I think that you guys, 20 years, it's a great achievement, and you guys, please continue.
That's great. I second that last statement. You mentioned the GRASP program, which at that time it was a funding program for master's students. I wonder if people can comment on how they were able to fund their PhD program and what choices they made when they were applying to different schools.
Well, I went into a PhD simply because I couldn't afford to do a master's program. I mean, it wasn't the only reason I really liked biostatistics and was passionate about it. But I wouldn't have been able to go to school anymore if it wasn't for going into a PhD, which is unfortunate because it's a field I enjoy. I like to think that I do well with it. So yeah, it's a big decision when it's a financial burden to you. Because even for me, for SIBS, I found out about it in my freshman year, so 2012, because my school really highly recommended the SIBS program, but I couldn't do it because I had to work over the summer to support myself and my family, so I wasn't able to do it until I lost my job the second summer, so yeah.
Yeah, I think for me, the financial part was really critical. I was considering going to medical school, but I wasn't sure how that was going to work out. And before I came to this program, I didn't know that there was any other options for me. My parents definitely were cutting me off from helping pay for higher education, so I knew I had to find something that was sustainable. And the graduate assistantship through Boston University for my MA PhD program was pivotal for me to come. I wouldn't have made it here without that, for sure, as I didn't know anyone in my family or otherwise besides the people in this program that had advanced degrees, so that wasn't something that I knew how to even get to, and that's something that I definitely learned through this program, that there was ways to, get funding for higher education levels, and I definitely wouldn't have pursued that without this program. There's an audience question.
Are we taking questions?
Oh, we have a question. Are you okay?
Yeah.
Yeah.
I'm not sure if it's Q&A time. I was just, does the GRASP program mean that the master's was fully funded, or what are the technicalities of that, I guess?
Do you want to just repeat the question, maybe?
Yeah, I'm going to repeat the question because you didn't have a mic. So this mic doesn't seem to be working. Now it is. The question that was asked was the program that we were talking about, which was called GRASP at the time, whether or not it funded the master's program. As it did at the time, you were able to fund just a master's or a terminal master's without having to do an MA PhD. I know, Taylor, when you said when you started, you chose particularly MA PhD because it was more likely to come with funding. I don't know if there's those opportunities now. I would comment that not just our alumni here, but many students and many SIBS alumni, that is a deciding factor on what program that they're going to apply to, is what is funded and what is not. And it is definitely a barrier to entry that is often discussed. I answered that correctly for BU. Yes. Okay. So I was going to talk. There's another theme that has been going around from both our speakers and some of our panel here, and I also can relate, which is many people didn't know what biostatistics was, sometimes until they were already in a biostatistics program. And that was true for me as well, and I think it's true for many of the SIBS faculty based on my knowledge. So can you guys speak to your introduction to the field and maybe offer some thoughts on how we can make biostats more known, like that this even exists? We don't always have to start with Taylor. Greg, are you okay starting?
I mean, I think part of it is, I think it was touched on a little bit in the first panel. It's basically just making it more sexy and, make it fun. I mean, partly it's just the messaging of what we're doing. I mean, we are increasing the portfolio, the diversity, and increasing. We want to increase that pipeline, but it's all about the packaging of the message and how you're presenting. How we present your results and statistics. I mean, you have to be engaging, and so partly I think with biostats, I think it's probably the same messaging. For me, it was just. I think it was bridging two disciplines that I was always interested in, clinical, like medicine and mathematics. And so for me, luckily went to SIBS because of that interest of that interdisciplinary aspect and the messaging that the way they packaged it and the way they made it important and really not correlated it, but really saw how it is reflected in the news and how you read the papers and how you interpret things. And that is what's missing these days. It's like people aren't really presenting it in a way that people can understand on a general way. And I think that's the gist. I think it's just the messaging.
Yeah, I think as an applied biostatistician, when I tell people that the New York Times, like 15 years ago, said that statistics was sexy, and I'm here to say that if you're at a party and you introduce yourself as a biostatistician, usually people's eyes glaze over a little bit. So I don't know that they were right about that. So if I say I'm a biostatistician and I'm interested in clinical trials, most people kind of look at me like I have no idea what that means. But if I can describe my work in terms of the problems that I'm trying to solve, I work in orthopedic surgery. I do a lot of work in people undergoing joint replacement. It's a major surgery, and about 20% of people who have a joint replaced actually are pretty unhappy, don't do well after they have a joint replacement. Can we come up with some statistical models to figure out who's doing poorly after joint replacement and why, and then come up with an intervention so that we can get those people doing better? And when I talk about it from that, kind of perspective, people always have a story. Oh, my uncle had his knee replaced and he had a terrible experience, and why do you think that was? And then they start listing off, here are the factors why I think my uncle had a really bad experience with his knee replacement. What do you think? And you start to open this conversation about, this is what I do. I don't sit at my desk and sort of like write out equations all day. I'm actually really trying to use mathematics to help improve public health. And when you can describe it from that and give these concrete examples, when people kind of recognize themselves or recognize somebody that they know in this example that you're giving, they do get really excited and want to hear more. And so I found that starting from that side of these are the problems that we're trying to solve can get people really excited about what we're doing.
Yeah, and I think from the corporate side of things, we're always looking for our ability to get back in and give back. And for me, it all is personally tied to this program and what I got out of it and feeling like I need to pay it forward. So me going back to the high schools in my area and encouraging programs of new statisticians coming into my organization and going back to their programs and continuing to build the community within the whole world. Each of us has our own responsibility for giving a little piece of it. I think like Lisa mentioned, it's all on all of us to give back and encourage, spread the word, especially as people who have benefited from this program, but also just the knowledge about what biostatistics is and what a great career it can be. I feel personally responsible for trying to tell other people about it and give them the opportunity to know what they can do. Because I wouldn't have known without this program. I can't personally create this program for other people, but I can tell them about the ones that are out there and do my part in trying to spread the word.
Yeah, for me, similar to what Allison was saying, I feel like I owe my entire career to this program and the people sitting on this side of the room. So when I did my PhD here at BU, my way to give back was to TA the program and eventually, help teach the SAS and get the students really excited about statistics and, what they could do with it and do they see themselves doing it. And it's been super rewarding because many of them have gone on to graduate school, they've done internships, they'll reach out, and it's been very rewarding to be able to help them the way that all of these people have helped me. Yeah.
Oh, that's wonderful. I want to make sure we don't have any questions online. Okay, so I would be remiss if I didn't ask this question. So we have 4 alumni here who are looking on the bright and shiny eyeballs of 24 new SIBSters. I don't know that stuck, but that's what we used to call you guys. And you're all here in your first week. Allison commented when she saw me looking over, and she asked me, are you sizing up to see who's talking to who and who's going to be the social one and who isn't? And apparently that does not turn off over the years. Sorry. So I am going to ask you, as you look out on the SIBS crowd, do you have any advice for them? Not just in the next 6 weeks, but as they move forward. And I will let whoever would like to speak first, please do.
I just think that, we've sort of hammered this home quite a bit, but the mentoring and the networking, I don't know about how all you feel, but, as an undergraduate, I felt sort of intimidated about talking to professors, about asking for help. I mean, that's probably why I didn't know about the SIBS program earlier. I went to career services instead of going to my professor, which I should have done. But, you don't want to bother anybody. And I think that it can be really limiting in a way that we're all here, and by we, I mean not just the people leading SIBS now, but all of the alumni, this whole network is here because we want to help the next generation of biostatisticians, and we want to be here to mentor and to support you. So to not be shy, if you hear from somebody this summer and you think what they're doing is really interesting, reach out to them. If you, one of the sessions that you do this summer, if you find it really interesting, talk to the person teaching it, that you're not sort of being annoying or bothering people, that we are really here, the universal we, to sort of to help it and to support you, and that's what you should be getting out of this program. And I just hope that you would take advantage of it and not feel like you shouldn't be doing that, because I think when I was in your shoes, I definitely felt that way. And I think I sort of casually mentioned to Lisa, oh, I'm going back to my job at the coffee shop this fall. Do you know anything? And, was really hesitant. I didn't want to ask. I didn't want to bother her. And, Lisa is so wonderful. And through her, I was able to meet, Dr. Dukes and get the job at DMStat. And if I hadn't, sort of had the courage to bring that up, I don't know what would have happened then. And so just to know that there is sort of a network here for you, and we want to be here to support you. And so take advantage of it while you're here and when you go home.
I'll just echo what you're saying, and likely you're all math nerds, so shy. Just grow out of it, and don't be shy to ask questions. I mean, it took me a while to learn that, but this is, like you were saying, this is the opportunity to ask questions, and this is really a pivotal point in your undergraduate careers, that you are forging your way to either go to grad school or work, and you're going to meet a lot of people throughout the summer that have a checkered career. Either you've worked in industry or they stayed in academia, and you can ask those questions about where they're at, how they got there. And when you're done with the program, again, I keep bringing this up, but the network that you are tapping into is really large, and it's going to be a great resource for you to use.
I would say try things that you're not sure you'll like. I had said earlier that I really wanted to do statistical genetics because I love genetics, but then I tried clinical trials, and it wasn't something I saw myself doing, but now that's what I do 40 hours a week. So yeah, don't be afraid to try something new, and just as the other panels were saying, be proactive, talk to the speakers. When the guest speakers come to lunch, sit next to them, sit near them, get a conversation going. And I would also say don't be discouraged if things if you try something and you don't like it, or you try something and it's not the right fit for you, because the path to success or the path of your career is definitely not linear. It's definitely a roller coaster ride. It is a lot of hills, a lot of valleys, but a lot of high points too. So just try new things and don't be discouraged.
I don't know if I have anything quite new after everyone else spoke, but definitely squeeze everything out of every opportunity that you get along your pathway. Ask the questions, evaluate things. You don't get to go back in time and ask questions, so ask them when you have them. Tap into your networks. someone once told me no one says no to interns, which I think kind of applies in this situation too. Get opportunities by just asking the right people and networking. That's great advice for your whole career, I think.
Are we, okay. I'm still looking to see if there's other questions. If not, I think that that's a lovely sentiment to end on. So I want to thank our panelists for coming and sharing their thoughts. I know we will be having, I will turn it back to Lisa.
Well, just, thank you, Lori. Oh, I need this. Okay, thank you, Lori. I do want to acknowledge all of the faculty and staff and guest speakers who've been part of this program. You've mentioned a lot of them. I want to thank Anita and Jackie and Helen for leading the program, and Howard always there, Mary was always there. We had so many faculty who were so important, and we lost 3 in the last few years who are very important to our program. So I just want to mention them. Their names have come up, and they were very important to all of us. Joe Massaro and Ralph D'Agostino and Adrian Couples were very important to this program, and we wouldn't be here having this celebration if they weren't part of it too. So just want to acknowledge them. And thank you all for your comments. It has been our privilege to work with all of you, and we're also proud of you and everything you're doing. It's great to sit here and listen to all the things that you have done. There's a lot of work that we all have to do to make biostatistics the field that we want to see it be. So let's keep doing it, because it sometimes feels like it's overwhelming, but every little bit counts. And so let's keep spreading the word. Let's try to get other people excited to be in our field. Let's share our stories, and let's keep up the good work. Thank you, everybody, for being here. And for those of you online joining us, thank you so much for being here today. Anita, thank you. Sorry we missed you. We would have loved to have you in person, but for those of you in the room, we have a reception. We'll be here, so start the networking now. Okay? All right, thanks, everybody.